Then we come to the peripheral vestibular tests. And here it's all about testing the vestibulo-ocular reflex, which means basically, the patient, you look at me and you move your head side to side. So this is what we call gaze stability. And the patient should be able to keep their eyes on target whilst they're moving their head, without the eyes disappearing off to the sides and without it provoking too much of a symptom. If there's no symptom, you speed it up a little bit. So try a little bit faster. You tell me if you're dizzy. That's good. Keep the eyes on me. That's good. And I would keep on doing that for a little while. Most dizzy patients will be dizzy with that test because they're moving their head and they don't like head movement. And again, you can do the same thing up and down, exactly. So keep looking at me, head up and down. Good. And all these tests with head movement also indicate to me how willing the patient is to move their head. And sometimes they don't like to do it. And you see all sorts of weird and wonderful things. And I ask the patient to turn the head side to side and they end up doing this kind of thing because the proprioception from the neck is so poor. Or ultimately, it turns into this kind of a thing, which is kind of completely bizarre. So
just in terms of, you said a dizzy patient is going to get dizzy earlier on in that test. Does that mean you might not be able to complete it to your satisfaction? You might not be able to rule out a red flag because they get dizzy before the red flag is obvious?
Generally, if the red flag is there, it will be there. It will be evident.
Straight away?
Yes.
Yeah,
and
okay,
it's not that it's kind of the red flags, remember, are the saccades and the smooth pursuits. Yeah. Peripheral vestibular problems will be with this gaze stability. Right. It's more the head movement, so you tend not to confuse.
So what we're really getting from this is just, does it provoke the dizziness, which is
exactly.
Useful
or can they not do it? I mean, again, if you see the eyes disappearing off to the sides, it means they've got very poor gaze stability, and therefore that should be worked on. Because all of these things are dysfunctions and can be improved with training.